Did you know that one small mistake while emptying a urinary drainage bag can increase the risk of infection in residents? In this video, I'll show you the correct CNA skills step by step, including how to measure and record urine output safely and accurately. Hi everyone, welcome back to Top Point Healthcare Training Hub. Today we'll learn how to empty a urinary catheter drainage bag, measure urine output, and properly document intake and output while maintaining infection control and residents' dignity. Supplies needed for this procedure includes your gloves, your graduate container for measuring output, alcohol wipes. You need your barrier, so you can put this on the barrier. You need your documentation paper and pen. For Missouri CNAs, you're expected to wear your gown and glove for this procedure. I also have this to show you what a urinary catheter looks like. So for Miss T today, we will be emptying her urinary drainage bag. When you come in, you introduce yourself, you provide privacy, you perform hand hygiene. First, our gown and gloves before we get. I'll put this on the floor. And my graduate on the floor. My supplies. I'll go ahead and open up the drainage bag. Make sure it's empty. Once it's empty, you lock this back up. And then with your sanitizing wipes, you clean off the tip and put this back. Now we have our urine here. We need to measure. So we'll have to put this in the flat surface to be able to get the right measurement for the output. This we're going to throw out. So now I have the urine and I have it in the flat surface. I'll go ahead and check the measurements. The numbers on this side, it's the ounces, and the numbers on the opposite side is the cc's. So for this resident, I was able to get out 12 ounces of urine output, and I'll go ahead and record it, dump this in the toilet, rinse, and bring it back to the resident's room. When I'm done, I'll go ahead and take off my PPE before I leave. First, I'll take off my gloves and put that away. And now I'll take off my gown. And this is how you measure urine output. There is always an order when a resident has to have their output and input recorded. Before you go, make sure you subscribe to this channel. We'll post healthcare training videos every single week, and you do not want to miss them. Hit the subscribe, turn on your notifications, and come back every week for more. We'll see you in the next one.